I'm Tom Garza, and today we are interviewing Dr. Roberto, small animal veterinarian, and Dr. Olagibel, family doctor, on Rocky Mountain spotted fever. So, Dr. Roberto, tell me, what is the intermediate host for Rocky Mountain spotted fever?
The intermediate hosts are ticks, and there's different types of ticks that can transmit Rocky Mountain spotted fever. The most common is the Dermacentor, the Varialis, which is the American dog tick, the Dermacentor andersoni, which is the Rocky Mountain wood tick, and the Rhizocephalus sanguinis, which is the brown dog tick.
What is the disease-causing agent of Rocky Mountain spotted fever?
It's a bacteria that is called Rickettsia rickettsii.
Where does Rocky Mountain spotted fever come from?
It originally was discovered in the Rocky Mountains. That's where the name came from. But since then, it's been found everywhere, and in all of the states, Florida, North Carolina, South Carolina. So it's pretty much everywhere.
Is it zoonotic?
Yes, it is. It is. It can actually be a fatal disease.
How does Rocky Mountain spotted fever affect an animal?
In an animal, it could be very vague. They can come in with just not wanting to eat, which is called anorexia. They can be lethargic, depressed. They can have joint pains. They can have fever. They can be vomiting. They can also get much more severe signs. The longer the disease is going on, they can start having bleeding disorders where their platelets aren't clotting, so they have what's called thrombocytopenia. So it's a disease that can present as many things. It's not a real specific symptoms.
So how do you diagnose it?
So the diagnosis would be based on where the pet was. So if the dog was in the woods, if he had had ticks in the past, and initially when we know that history, so history is very, very important, then we do blood tests, and based on our clinical signs and our blood tests, which some of the blood tests take a little while to develop positive, because they have to have a rise in what we call IgG, which is a titer test. And sometimes they have a very high titer, so they're positive, we know that. But sometimes it takes a while for them to develop that. So in the meantime, we don't wait. What we do is we start treating them right away. The best chance of survival is we treat them right away.
Thank you. Now, Dr. Olagibel.
Yes?
What cures Rocky Mountain spotted fever for humans?
The treatment for Rocky Mountain spotted fever is doxycycline. The treatment is very simple. It's 100 milligrams twice a day for 10 to 14 days.
Now, we said that it's found all over. Have you seen any specific cases of this disease?
Never. My 20 to 30 years of practice, I've never seen a person with Rocky Mountain spotted fever. Usually going to find in places that are a lot of agriculture, or places like India, China. They're not really developed, and they're in the woods and trees and things like that.
Is it most common in males or females?
It's most common in male because it's usually associated with the type of work that you do. A lot of farmers are males, and they're out in the woods, and people hunt mostly are males. But it could be to anybody. The tick doesn't care. He just wants to get what he wants to get. So if they're there, but just by logic, it's going to be the males that are out in the woods and doing things like that.
What are some ways to control and prevent Rocky Mountain spotted fever?
Well, I mean, the only thing you can do is when you go in the woods, you should take long sleeve shirts and you should tape them down. And they tape them down on both sides. They tape the ankles down. They try to put around the neck, like really tight things like that. And then when you come back in from hunting, or if you were in the woods or camping, whatever, then you check each other out to make sure the ticks are not on you, because you see them. It usually takes anywhere from typically between 2 and 14 days before you get the symptoms and the tick bites you. So what they usually do when they go hunting, I remember when I was a kid, we used to go hunting, we come back, we check each other out. You have to look through the hairlines and all that stuff because they're not easily seen.
How do you confirm that a patient has come in, and how do you know that he has this specific disease?
Well, it's a very difficult disease to diagnose. It has symptoms that most diseases carry, such as fevers, rashes, headache, nausea, vomiting, abdominal pain, which mimics appendicitis, which is very common, muscle pain, lack of appetite, and red eyes, so that could apply to anything. So if you don't act on it immediately, a clinical suspicion means that you're not going to wait to get laboratory and get cultures and wait 7 days, the person will be dead. You want to treat within 8 days, as fast as possible. Doctors like within 5 days before it spreads to your whole body. So it's based on the clinical suspicion that person might have this because he was in the woods, so he tells you something.
How does a patient die from this?
What happens is the disease progresses to your body. If you get it within 5 days, and that's why it's critical to have clinical suspicion the person might have this. So that's why the doctor was asking, what were you doing? Where were you at? Did you go to the country? Were you in the woods? Tell me. Because that's very important for the doctor to start thinking what he could develop. What happens once it gets to your system and it goes beyond the 7 days, it starts spreading to your kidneys, into your liver, into your whole body, and then it starts shutting down. So all your body systems shutting down, and then you go into failure, and then you have to put antibiotics or not doxycycline, and they give you side effects and destroy the tissues more, so it causes more death.
That is all. Thank you, Dr. Oberto and Dr. Loggy Bell, for everything.
You're welcome.
Do we get dinner now?
Yeah. Some of the things we put here, I don't know, did you want to add that or not?
What?
We also treat dogs with doxycycline. We usually put them on 10 to 20 milligrams a day, kilograms per day, for about 21 days. Again, if you don't treat the dog early enough, then they start developing severe disease where they go into all body shutdown and die. So the earlier you get them, the better chance they have of survival. Once they're treated appropriately, they survive, they become immune to the rickettsia. So once they're treated, then they have lifetime of not being able to get that again. But we use, to prevent it, we use things like the tick products. These are the topicals, some of the topicals. We also use collars. But year-round protection is very important. And again, the same thing. We want to know if the animal has been to a wooded area, has had tick infestation is very important. So same treatment, a little different, but it is something that, again, is not that common, but, we suspect it, we treat it before we wait for laboratory diagnosis. And remember that the ticks are contagious. If we get them with our fingers, if we have the tick and it ruptures and we have the juice or the feces or the body parts and we get it on us, we can also develop Rocky Mountain spotted fever if that tick is infested. So we need to wear gloves. We can get tweezers or hemostats to take off the ticks. So always handle the ticks carefully because you can get it that way too. And cats can also be positive on testing, but they don't have any clinical disease. And that's an interesting fact.
That's a wrap.
All right.